Hello everyone, Dr. Kimball here. I'm going to talk to you about something today that I'm actually pretty passionate about. I've been reviewing a lot of content online and seeing a lot of different health providers talking about how to heal your disc herniation. And it gets a lot of traffic, a lot of content, but I've never seen an actual spinal expert like myself talk about what the disc herniation is like and how it would be treated. First of all, anytime you injure something in your body, like you break your arm, you want to see it, right? You want to see the x-ray from your orthopedic doctor and you're like, yep, it's broken, I got to put a cast on it, it makes sense to you. When you have someone talking about your spine and relating it to a jelly donut, it doesn't really make sense because your body's not a donut. It's human tissue, it's real, and it doesn't heal like a piece of food, okay? So we'll get that off the table. Essentially, I'm going to go through a little video. I want you to see what a disc herniation looks like so you can kind of visualize it and understand, okay, well, how would that heal? What is it going to take? So you really just need to understand it. So I want you to see it. It might make you a little bit queasy. There's a little bit of blood. It's only for a few seconds. You can close your eyes if you don't feel comfortable and just listen along, and if you get confident enough, you can look at it. I think it's super helpful, so please watch it. Basically, what I want you to know is that the disc, it's a vital component to your spine. It separates the vertebrae, the building blocks of your spine. It's cushion. It allows for motion and movement, but sometimes that disc, it gets injured, it gets torn, and then the soft core inside that disc can actually leave its normal environment. When it leaves, it can push on a nerve, it can cause back pain and leg pain. There's all these misconceptions out there about how to cram that disc back into the disc space and let it heal naturally by sleeping this way or doing this exercise or whatever. There's actually scientific data out there that would help you understand that yes, some of these things are going to heal without surgery. In fact, at least 50% of them will heal without surgery. But until you actually see what a disc herniation looks like, you're going to have a hard time understanding, can it really heal? And do I need to see a specialist, or should I just keep going through trying to, position myself or treat it like a jelly donut? In this video, what you're looking at right now is a small tubular retractor that I'm working through. It's only about 18 millimeters. That's the size of a dime, okay? It's a minimally invasive approach. This procedure takes less than an hour. What you're looking at here is the nerve is being gently pulled out of position, and I'm reaching underneath the nerve to grab a hold of this large fragment of disc. And as you can see, as I start teasing this fragment out, it doesn't look like fluid. It looks more like the consistency of an orange or maybe even kind of like crab meat. I know that's kind of gross, but that's what it looks like. And imagine in your mind, is that going to heal on its own? As you can see right here, once I pulled the fragment out, there's actually a little defect or a little hole. That's where that disc came out of. That little hole or that little tear needs to heal. If it doesn't heal, more disc can come out, okay? So I can teach you more about that down the road, but now you know what a disc herniation looks like, and you can hopefully better understand that these things are more complicated than a jelly donut.